Which of the following maintains the lumen of the trachea? A. Air pressure within the respiratory tract. B. The tracheal cartilages. C. The infrahyoid muscles. D. The cervical spine. The answer is B. The tracheal cartilages. The lumen of the trachea is maintained by the tracheal cartilages, a set of approximately 20 separate C-shaped rings of hyaline cartilage. The non-continuous cartilage allows for greater flexibility during inspiration and expiration. Which of the following best describes the epithelium of the trachea? A. Pseudostratified columnar cells with cilia and goblet cells. B. Stratified squamous epithelium with cilia and goblet cells. C. Cuboidal epithelium with cilia and goblet cells. D. Transitional cells with cilia and goblet cells. The answer is A. Pseudostratified columnar cells with cilia and goblet cells. The epithelium of the trachea is made up of pseudostratified columnar cells with cilia and goblet cells. What structure is directly posterior to the trachea? A. The pharynx. B. The thyroid gland. C. The esophagus. D. The cervical spine. The answer is C. The esophagus. The esophagus is directly posterior to the trachea, and the cervical spine is posterior to the esophagus. The thyroid gland is anterior to the trachea. The pharynx is superior to both the trachea and the esophagus. What does the trachea bifurcate into? A. Left and right primary bronchioles. B. Left and right secondary bronchioles. C. Left and right secondary bronchi. D. Left and right primary bronchi. The answer is D. Left and right primary bronchi. The trachea bifurcates into the left and right primary bronchi. This occurs at a location called the carina, which is at the level of T4-T5. A nurse is about to perform an upper respiratory exam on a patient with sinusitis. Which of the following sinuses are inaccessible for assessment by physical exam due to their placement deep within the skull? A. The maxillary and frontal sinuses. B. The maxillary and sphenoid sinuses. C. The ethmoid and sphenoid sinuses. D. The frontal and ethmoid sinuses. The answer is C. The ethmoid and sphenoid sinuses. The only sinuses that can be assessed on physical exam are the frontal and maxillary sinuses. The sphenoid and ethmoid sinuses are too deep in the skull to be assessed via physical examination. Which of the following structures is the site of gas exchange in the lung? A. The bronchiole. B. The bronchus. C. The alveolus. D. The pleura. The answer is C. The alveolus. Gas exchange in the lung occurs exclusively in the alveoli, the tiny grape-like clusters of sacs at the terminus of the bronchioles of the lung. The gas contained in the larger structures of the lung, the trachea, bronchi, and bronchioles, is termed dead space as it does not participate in gas exchange. Which of the following is the main trigger for the impulse to breathe? A. Low blood oxygen. B. Constriction of the bronchioles. C. High blood carbon dioxide. D. Dilation of the bronchioles. The answer is C. High blood carbon dioxide. The main trigger for the impulse to breathe is high carbon dioxide, decreased blood pH. In response to a decrease in blood pH, the medullary respiratory center triggers the diaphragm and the external intercostal muscles to increase breathing rate. Myoglobin combined with dash molecules of oxygen, while hemoglobin combined with dash molecules of oxygen. A. 3. 4. B. 1. 2. C. 2. 4. D. 1. 4. The answer is D. 1. 4. Myoglobin, an oxygen-binding protein in the muscle tissue, combined with one molecule of oxygen. Hemoglobin, the main oxygen-binding metalloprotein in red blood cells, combined 4 molecules of oxygen. Hyperventilation results in which of the following? A. Ketoacidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Respiratory acidosis. The answer is B. Respiratory alkalosis. While hyperventilation or tachypnea may be triggered by various forms of acidosis, they will not cause a decrease in blood pH, but rather push the blood into a more alkaline state. This occurs due to loss of carbon dioxide during respiration, followed by a compensatory decrease in bicarbonate ions. The result is in an elevation in the pH of the blood. This condition is known as respiratory alkalosis. What does the term partial pressure describe? A. The pressure contributed by a single gas in a gas mixture. B. The pressure of an overall gas mixture during transition, adding a new gas. C. The pressure of a gas at 1000 meter above sea level. D. The difference between the gas pressure at a particular altitude and sea level. The answer is A. The pressure contributed by a single gas in a gas mixture. Many gases, such as room air, are composed of several gases, in the case of room air, primarily nitrogen, oxygen, and several trace gases. Partial pressure is the amount of pressure that each gas contributes. To find the total pressure of a gas mixture, one would find the sum of all partial pressures of each individual gas. How do oxygen and carbon dioxide cross the capillary epithelium and alveolar cell membranes during gas exchange? A. O2 transporter. B. Osmotic exchange. C. Simple diffusion. D. CO2/O2 pump. The answer is C. Simple diffusion. Gas exchange in the alveoli occurs by the process of simple diffusion. The blood that enters the lung capillaries is relatively low in oxygen and high in CO2, in comparison to the room air that is drawn into the alveoli during respiration. The separation between the capillaries and the alveolar epithelium is thin enough that these gases can exchange across their pressure gradients by the process of simple diffusion. Increased epinephrine would have what effect on stroke volume? A. Stroke volume would stay the same. B. It would cause irregularities in stroke volume. C. Stroke volume would decrease. D. Stroke volume would increase. The answer is D. Stroke volume would increase. Increased epinephrine, released either by the adrenal medulla or by myocardial innervation, increases contractility in the heart, which in turn increases stroke volume. Which of the following valves must blood pass through to go from the right atrium into the right ventricle? A. The tricuspid valve. B. The semilunar valve. C. The foramen oval. D. The mitral valve. The answer is A. The tricuspid valve. Blood in the right atrium must pass through the tricuspid valve to enter the right ventricle. The mitral valve is between the left atrium and the left ventricle. The semilunar valves are located at the base of the aorta and the pulmonary trunk, also known as the aortic valve and pulmonary valve. The foramen oval is a type of shunt that exists in the fetal heart. Its presence in an adult patient is a form of congenital heart defect. The S2 heart sound, dub, is heard during what part of the cardiac cycle? A. Diastole, during the closing of the aortic and pulmonary valves. B. Systole, during the closing of the aortic and pulmonary valves. C. Diastole, during the closing of the tricuspid and mitral valves. D. Systole, during the closing of the tricuspid and mitral valves. The answer is A. Diastole, during the closing of the aortic and pulmonary valves. The S2 heart sound, sometimes referred to as the dub-in-lub dub, occurs in diastole, during the closing of the aortic and pulmonary valves. When pressure within the aorta and pulmonary arteries exceeds pressure within the heart, the cups of the valves fill with blood and snap shut, causing the dub sound. Depolarization is able to travel in a uniform wave through myocardium due to what physiological feature? A. Gap junctions. B. T-tubules. C. Striation. D. Desmosums. The answer is A. Gap junctions. Depolarization is able to travel in a uniform wave through myocardium due to the presence of gap junctions. These junctions allow the depolarizing current to be transmitted directly from cell to cell in the heart. Striation in cardiac muscle is a feature of contraction, created by overlapping thick and thin contractile filaments. Desmosums are strong fiber-like anchors between myocardial cells and T-tubules, while an important part of depolarization, are not responsible for the rapid intercellular communication that occurs as a result of the presence of gap junctions. Parasympathetic innervation of the heart is primarily controlled by what nerve? A. The cardiac nerve. B. None of these is correct. C. The vagus nerve, CN10. D. The recurrent laryngeal nerve. The answer is C. The vagus nerve, CN10. The vagus nerve provides the main parasympathetic innervation of the heart. The recurrent laryngeal nerve, a branch of the vagus nerve, innervates the majority of the intrinsic muscles of the larynx. The cardiac nerve is part of the sympathetic innervation of the heart. What coronary artery supplies left atrium and left ventricle? A. The left coronary artery. B. The septal branches. C. The left circumflex artery. D. The posterior descending artery. The answer is A. The left coronary artery. The majority of blood supply to the left atrium and left ventricle is provided by the left coronary artery. The septal branches and left circumflex artery are smaller divisions of this main artery. The posterior descending artery supplies the posterior 1/3 of the interventricular septum. A nurse is performing an abdominal exam and notices a strong pulse in the abdomen just above the umbilicus. She is most likely palpating what blood vessel? A. The femoral artery. B. The exterior iliac artery. C. The inferior mesenteric artery. D. The abdominal aorta. The answer is D. The abdominal aorta. The nurse is most likely palpating the abdominal aorta. This vessel is large, generally 2.5 to 4 centimeters in diameter, and a strong pulse can often be felt on palpation. The femoral artery is also an area where a pulse may be felt, but it is only palpable in the mid-inguinal point of the inner thigh. The exterior iliac artery branches off of the abdominal aorta below the umbilicus, and the inferior mesenteric artery is a minor artery and is not generally palpable on examination. What is the formula for finding cardiac output? CO. A. Cardiac output equals stroke volume divided by heart rate. B. Cardiac output equals stroke volume multiplied by heart rate. C. Cardiac output equals ejection fraction multiplied by heart rate. D. Cardiac output equals ejection fraction divided by heart rate. The answer is B. Cardiac output equals stroke volume times heart rate. Cardiac output is the measure of the amount of blood that is able to circulate through the heart in 1 minute. It is found by multiplying the stroke volume times the heart rate, in beats per minute. The ejection fraction, another important measure of cardiac function, is not considered when calculating cardiac output. Oxygen-poor blood flows from the dash to the dash. A. Vena cava. Left atrium. B. Pulmonary arteries. Right atrium. C. Vena cava. Right atrium. D. Pulmonary veins. Left atrium. The answer is C. Vena cava. Right atrium. Deoxygenated blood from the body flows through the superior and inferior vena cava into the right atrium of the heart. From there it enters the right ventricle, then is ejected into the lungs via the pulmonary arteries. The blood is oxygenated in the lungs, then flows through the pulmonary veins into the left atrium, then into the left ventricle to be pumped back out into the body. How does parasympathetic innervation affect the heart? A. Increases heart rate and decreases cardiac output. B. Slows heart rate and increases cardiac output. C. Slows heart rate and decreases cardiac output. D. Increases heart rate and increases cardiac output. The answer is C. slows heart rate and decreases cardiac output. Sympathetic innervation will decrease the heart rate, which will automatically decrease the cardiac output equals stroke volume multiplied by heart rate. Which of the following causes the S1 heart sound, lub? A. The opening of the aortic and pulmonary valves. B. The closing of the tricuspid and mitral, atrioventricular, valves. C. The closing of the aortic and pulmonary valves. D. The opening of the tricuspid and mitral, atrioventricular, valves. The answer is B. The closing of the tricuspid and mitral, atrioventricular, valves. The S1 heart sound, sometimes referred to as lub, is caused by the sudden snapping shut of the tricuspid and mitral valves during systole, when the heart contracts and tension on the chordae tendineae is released. No sound is produced on the opening of these or any other valves in the heart. The contraction rate is set in what area of the heart? A. The bundle of His. B. The atrioventricular node. C. The synovial node. D. The Purkinje fibers. The answer is C. The sinoatrial node. The contraction rate for the heart is set by the cells of the sinoatrial node, also known as the pacemaker cells of the heart. These cells have membranes that are especially permeable to ions, and are able to depolarize on their own at a rate of 70 to 100 beats per minute. All the other areas listed do have their own spontaneous contractility, but their rates are slower than that of the sinoatrial node. Thus, the sinoatrial node is the pacemaker in a healthy heart. Which of the following is the proper unit of measurement for blood pressure? A. Millimeter of mercury. B. Gram per deciliter. C. IU. D. Deciliter per millimeter. The answer is A. Millimeter of mercury. The proper unit when recording a patient's blood pressure is millimeter of mercury, or millimeter of mercury. This is derived from a historical measurement of how many millimeters of mercury in a mercury manometer were able to be elevated by a particular pressure. Due to its toxicity, mercury is no longer used in medical equipment, though the millimeter of mercury unit remains in use. A patient has a 49-year history of hypertension. Which part of the heart would be most enlarged on echocardiogram? A. Right atrium. B. Left atrium. C. Left ventricle. D. Right ventricle. E. Pulmonary artery. The answer is C. Left ventricle. The left ventricle is the most commonly enlarged heart structure seen in chronic hypertension. The left ventricle must overcome the afterload of the arterial system by becoming hypertrophied. As a result, the heart gets remodeled to overcome the systemic high blood pressures. The left ventricle directly pumps blood from the heart to the systemic circuit.